Sunny 95.
The show that brings you man-on-the-street interviews, celebrity guests, groundbreaking research, and heartwarming stories about the reasons we smile. Our show is also known as everything you've always wanted to know about dentistry, but were too numb to ask. Hello, I'm General Dentist Dr. Kvitko, and thank you for joining me today.
The following views and opinions do not necessarily reflect those of this station, its staff, management, or parent company. To hear a replay of this show or one of the great shows that previously aired, log on to thereasonswesmile.com or iTunes, keyword Dr. Kvitko or The Reasons We Smile. Listeners should not use Dr. Kvitko's comments and advice in place of an actual dental exam.
Brighten your life with a smile that shows the professional touch of Dr. Kvitko.
Time now for The Reasons We Smile with Dr. Kvitko. Call 459-9769 to discuss your dental issues. Now, here's your host, Dr. Kvitko.
Hello, everyone. Welcome to The Reasons We Smile. I'm Dr. Kvitko. This is episode number 556. I really appreciate you tuning in. Thank you so much for joining me. I think we're going to have a fun show. Today, the title is What Makes a Dentist a Great Dentist? Okay, and I'm sure you all have your own opinion of that, but I'm going to give you mine. Before we get started, let me remind you, if you would like to follow me on Twitter, it's at Dr. Kvitko. And if you'd please go to my office Facebook page and like us, that would be awesome. Also, all past episodes, complete with video, are available at thereasonswesmile.com, and we are streaming live on Facebook. Last week I couldn't figure it out. This week I did. Anyway, okay. So, want to remind you that we're going to be giving away flowers in about 10 minutes from DeSantis Florist. You'll have a chance to call in and win those flowers by calling 614-459-9769. So if you want to pre-program that into your phone, you can do that now. It's 614-459-9769. Try to make the question easy. If you've been paying attention at all, you'll have the correct answer, and sometimes even if you haven't been paying attention, you'll have the answer, because I know it's early and we want you to win. Okay, so let's start with someone who does not cut corners. I think would be a great dentist. You wouldn't want somebody to cut corners in your mouth, would you? And the thing is you're not going to know that. So most people, here's the thing, most people think a person or a dentist is a great dentist if they don't hurt them and if they seem like a nice person. Those are great qualities, and you need that as well, but you also need to know that they're not going to take shortcuts, not going to cut corners. And so really it comes down to what is the person going to do when nobody's looking, you know? So keep that in mind, and I know that one way you can tell if the corners are being cut possibly would be to figure out how long it takes. So for example, if you go in for your exam, x-ray, and cleaning, and it takes 30 minutes, that's not long enough. You can't do it all in 30 minutes. It should take about an hour. All right? I was talking to a guy at the store yesterday who recognized me and came up and we were talking. He says, I've been meaning to come to you. And I go, why didn't you? He says, yeah, I should do that. And so we were talking about the differences, and I was talking about this very thing, and he says, well, my dentist, it takes them 45 minutes. I go, well, that's getting close. That's better, but that's not an hour, you know? So what's being missed in that other 15 minutes? Okay, another would be someone who cares about your comfort. Now, a lot of people say they care, and their advertising says they care. They even, give their dental office a name, like comfortable or comfort or gentle this or gentle that or kind and caring. But it turns out, in a lot of cases, it's just a slogan. You get there and it hurts like it did at the last office, right? I've had people tell me that. So here's the thing. If your dentist truly cares about your comfort, they're going to make sure that nothing hurts, that your neck is in a good position, that if you need to use the restroom, you can go use the restroom, all of that. If you can't be reclined all the way, you're not reclined all the way. I mean, I'll stand. I don't like it, but I'll stand and work on somebody who has this back issue or neck issue, vertigo, and they get dizzy if they're put back. That has something to do with the 3 little bones in the eye, the hammer, the anvil, and the stirrup. I guess they get little crystalline formations on them, and it causes people to get very dizzy when they're reclined quickly. Okay, another one. So we're up to number 3. A dentist who tells you what is going on in your mouth, even if it's not what you want to hear. So, don't mince words. If you have an abscess, they're going to tell you you have an abscess. I mean, you're a big person, you're a big boy, a big girl. You can handle the truth, right? So, if you have gum disease, if you have bone loss, if you have cavities, if you have other things going on, a good dentist is going to tell you, even if you don't like it. And, sometimes I've heard and I've seen firsthand from patients or inpatients who used to go to other dentists and went there for several years, and they come to me and their mouth is a mess. And I'm looking at their chart, and I know that they were at the dentist 6 months ago, sometimes more recent, and I'm like, well, how could they be in this condition? And the only thing I can think of is the dentist might have been afraid of telling the person you need an expensive procedure. So I think rather than saying you need a root canal, they decided to wait until the person called them with a toothache. And then the person would say, oh, my tooth hurts, and then it's like, oh, well, you need a root canal. Okay, let's do it. Rather than the uncomfortable conversation of saying, hey, Mr. Smith, you need a root canal, and then having Mr. Smith go, well, nothing hurts. How much is it? $1,400. Well, nothing hurts. You must just need a boat payment. So the dentist was trying to avoid that conversation, and in my estimation, that wasn't the best thing for the patient. Why wait till you have a toothache that could affect your life, Could affect your vacation or your day off or even having to miss work. So anyway, the first three then, if you remember, is we want a great dentist is someone who doesn't cut corners, someone who cares about your comfort and really, really cares about your comfort. And number three is who tells you what's going on in your mouth even if it's not what you want to hear. Okay, and I've actually had patients sit down and say, I hope you don't find anything today, or don't find anything today, or and I'll ask them, do you want the one eye open exam or the no eye open exam? I mean, my answer has always been, you're paying me good money to do an exam, tell you what's going on in your mouth, and I'm going to have both eyes open and I'm going to do it, so be prepared. Okay, anyway, the next one, someone who is a lifetime learner, all right? If your dentist is doing the same thing that he or she did the day they graduated, if they haven't added any new services, they're not a great dentist. They may be good at what they do, but you're not getting the benefit of the latest and greatest. I met a dentist who was about my age or older, and he talked a lot about all the greatest technologies and knew this and knew that, and I'm thinking, great, there's somebody else like me in my age bracket that has kept up. And then as I got to meet the guy, I realized he wasn't doing anything different. Yeah, there's new composite restorations, but he wasn't doing that. It's just that's what they sold him. They come out with new products that are better and they sell them to us. And so he didn't have a laser. He didn't have the same-day crown machine, the CEREC. He didn't have anything, a cone beam scan. There was just nothing new. So what has your dentist learned? And you can ask him, hey, what's the last thing you learned at a CE course? Just for fun. See what kind of an answer you get. Anyway, and by the way, I'm not disrespecting other dentists. I'm just giving you, the patient, an idea of how you're going to measure, okay? How you're going to measure. Because I'm telling you what, the patients that went to the dentist I was telling you about, where they all had all kinds of stuff going on in their mouth, they were perfectly happy. They just didn't know better, right? I get this. So anyway, okay. So a lifetime learner is number 4. Someone who gives back to the community. I think that's important. I really do. And I would like to say this community. Let's give back to right here in our own neighborhood. I'm not all that impressed by dentists that go to Honduras or Nicaragua or whatever to do free dentistry. I mean, that's great, and you're helping people, and I understand that, and they need it. But we need it here too. They could all step out of their office, walk 1 block to the right, left, and they would run into half a dozen people that could use some help, And a lot of times they're sitting right next to you at work. There could be, your kid's soccer coach, right? Anyway, so people who have jobs sometimes still don't have the money to take care of themselves properly when it comes to dental care, and because their job maybe doesn't have insurance, and so we should help right here. And I'm going to tell you, it's really hard to find dentists that are willing to donate their time, because I've tried for good 8 to 10 years, and I'll get a handful. After contacting every dentist in Central Ohio, I maybe have 2 or 3 show up at one of my events. So I'm thinking those people, I think they're just better people, because they care. They have a heart, right? It's not all about money. So giving back to the community is something I think is important. Our community. I think the other ones, don't get me wrong, again, it's good stuff. But aren't they going to Nicaragua because it's a vacation I get to go to on a trip, get on a plane, this is cool, right? It's not so cool to take a homeless person that's been sleeping on your bench outside the office and say, let me do some free dental work for you, right? So, okay. A passion for what they do. Is your dentist passionate? Do they talk about it? Do they live, sleep and breathe it? Because if they do, I believe they're going to be better at it. That makes them better, right? People who have a passion for what they do are better at it. I don't know if it's why they're passionate or they're passionate because they're better at it. I don't know what it is, chicken or the egg. It really doesn't matter. But having passion makes you a better person in general, and it makes you a better person at whatever your job is. If you're a passionate accountant, you're going to be better at accounting. You're going to understand everything the IRS is going to be looking for, and you're going to be on top of it, right? At least that's my thought. So, okay. So we've covered 5. I didn't count them. There are a number of them. It's probably more than 10. And these are all mine. I didn't get these off the internet, so nobody gets credit for it, but then nobody gets blamed if I'm pissing somebody off. So, anyway, but we're going to do Dr. Kvitko's question of the day. And remember, the first 3, someone who doesn't cut corners, someone who tells you what's going on in your mouth even if you didn't want to hear it, and someone who cares about your comfort. That's pretty much going to be what you need to remember. So, before we do the contest, let's listen to this.
This station will not be held liable for any contesting during The Reasons We Smile with Dr. Kvitko. Participation in the contest allows Dr. Kvitko to record and broadcast your name and call. 1 winner per household. Prizes are non-transferable, cannot be substituted, and are subject to taxes and fees. This station cannot be responsible for the inability to enter the contest, whether due to equipment malfunction or telephone difficulties. All decisions of Dr. Kvitko concerning this contest or eligibility are final.
And now it's time for Dr. Kvitko's question of the day.
All right, today we are bringing you the traits of a great dentist. What are some of the traits that we've mentioned so far? A dentist that does not cut corners would be considered great. B, a dentist who genuinely cares about your comfort would be considered great. C, a dentist who tells you what is going on in your mouth, even if it's not what you want to hear, is great. Or D, all of the above, all right? The winner's going to receive those free flowers from DeSantis Florist. They'll be delivered to your place of business this Tuesday afternoon. The number to call is 614-459-9769. That's 614-459-9769. So go ahead and call now.
You won't believe it though. I want to hear your mind. And there's nothing else in the world tonight. She said people don't take the time. Hey, people don't take the time.
Hi, I'm Keith Carlos, winner of America's Next Top Model and star of Chocolate City 2. Look for my smile on the big screen this summer, courtesy of Dr. Kvitko. Stay tuned to The Reasons We Smile with Dr. Kvitko, the world's most interesting dentist.
Hi, I'm Dr. Kvitko, general dentist and host of the Reasons We Smile radio and roadshow. Did you know that you no longer need to visit several different dental professionals to get more complete dental care? We handle everything from cleanings and orthodontics to restoration, implants, and smile makeovers, all in my office. And now we have 2 locations. Get the most advanced technology and procedures available today. It's more complete dentistry.
Visit worldsmostinterestingdentist.com for more info about Dr. Kvitko.
Dr. Kvitko, let's go!
Hi, this is Richard Simmons. Dr. Kvitko's here, and he's going to help you with all of your problems. Are your teeth yellow? He can fix that. Are you missing a tooth? He can put a new one in. How is that?
That's very good. Thank you, Richard.
All right, we're back. We're doing Dr. Kvitko's question of the day. We have 3 callers on the line. We have Erica, Michael, and Chase, and we flipped the coin a couple times, and it came up with Chase. Hey, Chase, how are you? Hello? Oh, there we go. Chase, you there?
Yeah.
Oh, good. Wasn't sure we had you there. All right, Chase. Well, hey, thanks for tuning in. Do you have the answer to Dr. Kvitko's question of the day?
Yeah.
What is it?
D.
D, all of the above. All right. Chase, what do you do for a living?
I'm a nurse.
Oh, cool. So you're up and working like I am, aren't you?
Yep.
Because I'm here in the studio live. All right. Hey, stay on the phone so we can get the information where to send those flowers. We really appreciate you tuning in and calling in. For those who didn't win, please call in next week, okay? Thanks, Chase.
All right, thank you.
Uh-huh. Okay, so if you're just joining us, I'm Dr. Kvitko. This is The Reasons We Smile. It's episode number 556. And so if you're a first-time listener, you've missed a few episodes, you can access them by going to thereasonswesmile.com. And today, we are bringing you what makes a dentist a great dentist? Traits of a great dentist. This is according to me, but I'm hoping that you agree. Okay, so now, the next one I want to talk about is, get this, someone who answers their phone during lunchtime. Does that drive you crazy? The time you have to call the office is during your lunch, and then they're at lunch. That makes no sense to me. It's like, can you really not just stagger your lunches so somebody can answer the phone? That's what we do. So maybe that doesn't make me a great dentist, but it maybe makes me a better dental office than some. You know what I mean? Well, maybe it does make me a better dentist because I care. You know what I mean? So we answer our own phone during your lunchtime, and you can reach us. And by the way, a follow-up to that would be that you can reach the dentist. I'm looking for it where I wrote here. You can reach the dentist 24 hours a day. I mean really reach the dentist. Now, I have a 24-hour answering service, 365 days a year. Their job is to take your information and to page me. Well, they text me. If I don't clear the text, if I don't let them know I got my text, they call me in 10 minutes. They call my house, they call my cell phone. This is my instructions to them. So I think that makes a dentist better if they're reachable when you need them, whether it's for a toothache or you just have a question or whatever. And let's face it, sometimes when a person is calling and they have an issue, I've had people call, they're at the airport. They're having this terrible toothache, they're on a layover from one flight to the next, and they don't have a lot of time to track me down. So the fact that they can reach me is very helpful. And then the other thing, along with that would go, they're willing to come to the office after hours if you're in pain or have an emergency need. Now, the emergency need isn't always in pain. Sometimes an emergency need is, I broke my denture, my partial denture, but I'm going on vacation tomorrow. You know, it doesn't hurt. Could they go on vacation with a broken denture? Maybe. Do they want to? No. Should they have to? No. Not if they have a great dentist, you know? So anyway, being available. And by the way, you guys should test this out. Call your dentist at midnight. See what happens. See if you get a call back. Call them at 2 in the morning. Because here's what happens. You get a voicemail. I'm sorry, yeah, you get their voicemail that says, well, you call the office, it says, if this is an emergency, call Dr. So-and-so, here's his cell phone number. You're like, great, I got his cell phone number. You call the cell phone, it says, hi, this is Dr. So-and-so, leave me a message. There's no indication if you'll get a response, if you'll ever get an answer, and if you do, when it might be. And I can guarantee you, from what I've been told by patients and what I've found over my 38 years, if you will not get a call back. You won't. When I was when telephone book was king, people would go through the phone book looking for a dentist when they were in pain. They started the A's and they'd get to the K's because I would be the first one to call them back. So they would tell me. Some people told me they started at the Z's and worked their way forward in the alphabet and still got me. Nobody seems to care about patient care after hours, and I do because I take what I do seriously. I truly care. It kind of goes in with the passion for being a dentist as well. Okay, do they have convenient hours? I can't tell you how many how many staff members I've lost because I have convenient hours for the patient. I lose people all the time who say, well, I can go down the street and get a job and work from 8 to 4 Monday through Thursday. Well, 8 to 4 is not very convenient for patients. So I lose good staff members. Maybe they're not as good as I thought, or they wouldn't have left me just for that reason, right? But anyway, so I think that there ought to be some convenient hours. Does that mean you have to work till 10 every night, or 9 or 8? No. But it means you have to work past 5 or 4 or 6, 6:30. Especially, if you have a 3-hour appointment. Somebody can't take off work very much. Maybe they can take an hour off and you can start the visit at 4. Who knows? But having something. And anyway, okay, let's go on to the next one. Has a good chairside manner. We call it chairside manner instead of bedside manner. And, what does that mean? It means that you can get along with people of all walks of life, that you can get along with people of all socioeconomic levels, that you can work with people who are, their hearing is slightly impaired, or their vision is slightly impaired, or English is not their first language, or they're nervous, they're afraid, they gag, there are all these challenges, people with back issues, people who came in a wheelchair, being able to help somebody understand what it is that we are saying. What is a root canal? What is an implant? What is the procedure? What is a connective tissue graft, and why would one need it? And what's the process of having it done, and how am I going to feel afterwards? And so, essentially, if you can address a person's not only their concerns but their reality, and make them feel comfortable, I think that means you have good chairside manner, and you're going to always put the patient first. That might be another way of saying that. Okay, so let me look here. Looks like it's probably time to go to a break. I'm looking at the clock. Although there's no more clock on the wall. Somebody took the clock on the wall, and we can't seem to get the general manager to buy a $2 clock and put it on the wall, right? I'm having a meeting on Thursday. Maybe I'll ask him on Thursday. Anyway. All right, so you're listening to The Reasons We Smile with Dr. Kvitko, episode number 556, and we'll be right back.
You can take me as I am, not just a little bit. I don't know who to be. I'm a paper cup, baby, of the sea. I know you see it too, 'cause you're too much for me.
This is Clark Kellogg. Stay tuned for more of Dr. Kvitko.
Estás escuchando con Dr. Kvitko aquí en su sesión favorita.
Hi, I'm Dominique Reichert. Like what you hear? Why not use the show to promote your product or service by becoming a sponsor? Call 614-262-9588 to learn how. That's 614-262-9588. Call now.
Hi, I'm Dr. Kvitko, general dentist and host of the Reasons We Smile radio and roadshow. I've been honored to help several famous people get a perfect smile, like Keith Carlos and Dominique Reigard from America's Next Top Model, and Ted the Golden Voice Williams from right here in Columbus. Isn't it time you had a celebrity smile? It costs less than you might think, and most of the time, it can be done in one visit. A new smile can make a world of difference.
Visit worldsmostinterestingdentist.com for more info about Dr. Kvitko.
I'm Grandpa, and I go to Dr. Kvitko, and I still have all my teeth. Real ones. Where's my glasses?
All right, we're back. This is The Reasons We Smile. I'm Dr. Kvitko. Thank you so much for joining me. It's episode number 556. We're bringing you what makes a dentist a great dentist, or traits of a great dentist, according to me. No one else to give props for this topic. Normally I do. I search the internet and try to give everybody credit for what they've done. But this time, it's me. All right, so here's another one. I think that if the dentist will fit you into their schedule when you have an urgent need, that's a sign of a great dentist. Because I have had people tell me, well, I called my dentist, but they can't get me until Thursday, and it's Monday. It's Monday. So, I'll look at my schedule and I'll go, all right, let's see. If we have them come at this time, then we can have one of the assistants get them back, maybe take their x-ray, find out what the issue is, and then see at our office. With the technology we have, I can view anyone's x-ray from any treatment room. I can view it from home, from my laptop. I can view it from both offices, and I can view it from my cell phone. So the point is I don't have to be in the room to see what this person has presented at the office with. And so then I can say, all right, so then we're going to know what it is, and if it's this, based on what you've told me when you call, then I would probably have time to stop here and get them numb. And then by the time they're numb, I'll have this person's filling done, and I'll be able to come in. So we work somebody in that way. We don't make the patient who's in the chair already suffer or, treat them poorly or, shorten their visit at all. But we find a way to get somebody in who has an urgent need, and I think a great dentist will do that. Even if it means somebody has to work through their lunch or into their lunch, even if it means they might go home a little late, because to me, the patient is the most important thing, and providing a good service every day, all of the time. All right. So, by the way, I'm keeping track now because I hadn't numbered them. That was number 12. Let me see what we're going to decide number 13 is. 13, let's hear. Okay, 13, we'll go with this one. Does what is best for you regardless of what your insurance company says. So, just because your insurance company doesn't pay for an implant, for example, doesn't mean you don't or need one or will benefit from one. Or just because your insurance company says they don't think, and they don't know, they haven't seen you, they don't want to pay for a crown, doesn't mean you don't need one. So, and we're still going to recommend the best treatment for you, and I think every great dentist will. Now, there are some dentists that only do what the insurance company's going to cover because they don't want to have to argue with you and don't want to have to argue with the insurance company. But remember, folks, they're not looking out for you. Your dentist is. And so take what your dentist says is the information that they have determined about what you need. Take that as the truth rather than what an insurance company who you're just a number, they've never met you, they've never looked in your mouth. And if they even have an x-ray to look at or a photograph to look at, sometimes those don't tell the whole story. I can tell you for a fact I did to, well, here's the case. This guy, I knew he needed a new crown because this one side of his bridge had come loose. Right, he was even skeptical. But I knew there had to be decanter there. It wouldn't be flopping around on one end, right? So we took the bridge off, and there was mush at the top. But when I went to clean out the mush at the top, I discovered the entire top half of the tooth, everything above the gum line, it was the lower tooth, was mush. It had turned, it was a little bit like a Jell-O mold. It looked like a tooth, but as soon as I touched it with an instrument, it just mushed off. Yeah, just crazy stuff. They can't see that on an x-ray because the bridge, which is metal, was hiding it. So he needed a new bridge, and if your insurance company had said you didn't, or his insurance company had said you didn't, well, they would have been wrong. All right, here's another one. Willing to do things over at no charge if they don't turn out as expected. All right? So I think that's important because I have this family. This girl had Invisalign in another office, and she has an upper left lateral incisor that is completely hidden. Her upper tooth is hidden behind the lower one. And rather than fixing it, they said it was her fault because she didn't wear her aligner. Well, to be honest, that's bull. It is bull. And so this girl her parents can't afford to pay for it again. So now this girl, she's a pretty girl, is going around with crooked teeth even though she's been through Invisalign. That dentist should be redoing it at no charge. Not a great dentist there. Someone who respects your time, okay? So someone who's not going to start late. So you get there at 7:30 for a 7:30 appointment. They need to get you back at 7:30. Maybe 7:29 if you're there early, or 7:25 if you're there. Okay? Because everybody's busy these days. Everybody's busy. Okay, the next one is has the latest and greatest technologies, and we've hit on this just a little bit. And I'm going to look at my time here and make sure I'm not going to go over. Okay, I just got the sign that it looks like I have 1 minute, so I'll talk fast. All right. Okay, so basically then, let me just say this. We'll make the last one somebody that shows... no, there's a couple more. Somebody that shows compassion. You have to show compassion. I mean, really, understand what people go through, whether it's the money or the fear. You have to really relate to them and not just say, oh, sit still. That's not the way to be. And then I guess maybe this is all leading up to the last one I'll do is someone who is a genuine good person. You want a genuinely good person to be your dentist, and I think that makes a great dentist as well. Okay, it looks like I am out of time, very much so. So thank you so much for tuning in. Really appreciate it. Next week we're going to have the traits of a great patient, a great dental patient. Okay? Don't forget to follow me on Twitter, and follow me on Facebook. And remember that all past episodes, complete with video, are available at thereasonswesmile.com. Be sure to tune in next week and every week right here on your favorite station. Goodbye.
This is Carly Red from Love and Hip Hop Atlanta, the hit show on VH1, urging you to tune in next week with my dentist, Dr. Kvitko.
If you're interested in learning more about this and other dental health topics, go to thereasonswesmile.com to access full episodes of Dr. Kvitko's show.
If you'd like Dr. Kvitko, the world's most interesting dentist, to speak at your next event, please call 614-262-9588. That's 614-262-9588, or send an email to speaking@thereasons